Hi, Kat. I'm so excited about your pregnancy.
Yay, thank you.
How many weeks are you?
I'm 26 weeks today.
Okay.
So, yeah.
Okay.
Very,
That's really exciting.
Yeah.
How's your body feeling?
It's feeling pretty good, I think, overall. I'm having little aches and things, but I think that's part of the course, really, because it's changing so much, and there's nothing really hurting. It's just little weird things I feel off and on.
Okay.
But
Yeah. So, can you describe any of those weird aches and pains?
yes, so really right now it's kind of around the SI joint, which I know is kind of the classic spot. But yeah, that's really especially when I'm flexing my hip, I feel it a little bit on the right side.
Okay.
Yeah.
Does it feel like pressure?
Yeah, yeah, just kind of right in one little area back here, and it's only really when I'm like putting on socks or doing something where I'm bending that hip out toward the belly that it's talking to me. So.
Right. So yeah, usually when that happens on one side of the sacrum versus another, it's because of increased compression of the femur backward, and it alters the ligaments that connect to the sacrum. So
Okay.
it's usually not always the sacrum itself; it's the little ligaments.
Okay.
Okay. Just so you know, not to be afraid of it.
Yeah, exactly. And I know the further along I go, the more lax the ligaments will be, and probably the more I'll be feeling, little things like that. But it's worth it. It's not too bad. So
Okay.
yeah.
Well, I know you had some questions for me.
Yeah, absolutely. So really, I guess to start, how did you come up with the idea for Train4Birth?
Okay. So I was in a clinic and seeing women both pre and postpartum, but mostly postpartum, and I just noticed how challenging it was for new moms, sometimes with multiple kids, to come in at a certain specific time, try to figure out the right time around their baby's schedule, often bring their kid with them or find childcare, and it's just very hard to focus on yourself in a clinical setting when you've got to watch for your baby to not be disturbing anyone else. And that plus sleep deprivation and just all the things that kind of hit you as a new mom after baby, it really made me want to take a step back and say, okay, let's work on ourselves and do some self-care before we have that extra responsibility. So I piloted the program first with myself when I was pregnant to test it out, and then when I felt good about it, then I posted on a Facebook group and just volunteered the program for free, and 56 women within 24 hours said yes please.
Nice.
And so I followed them throughout their pregnancies, and within that group there were women with twins, there were women planning C-sections, when unplanned C-sections happened, natural birth, home birth, and hospital birth. So it was a really great mix of women, and they all except one had a great outcome. One ended up having a miscarriage, but
Okay.
yeah, and it was really great to follow their pregnancies, check in with them every week, and actually most of them were second-time moms, so they had their own first pregnancy to compare it to, and they said the second time around, having done the Train4Birth program, really helped them out a lot.
Nice. That's awesome. I know you said you saw women in the clinic. Tell us a little bit about your background.
Okay, so I went to physical therapy school at University of Tennessee in Chattanooga, got my doctorate in physical therapy, and then worked both inpatient and outpatient. Ultimately did a year-long orthopedic mentorship program and then a year-long women's health.
Oh wow. Okay. That's awesome.